I'm Dr. Gorman. For those that haven't met me before, I have someone at the back who's going to let me know if she thinks she can hear me loud enough. So if I'm not loud enough, just ask me to speak up a bit. So really, I'm just going to introduce some of the studies that I recognise a lot of people here actually are actively involved in these studies or have been involved in these studies. And this slide's really following on both from Professor Chinnery and Professor Turnbull, because our way of identifying people with different forms of mitochondrial disease has been difficult in the past. But now that a lot of you now recognise the cohort preliminary, which has been now in the go for several years, really led by Victoria and by Dr. Bobby McFarland, we can now identify people with different forms of mitochondrial disease. A lot of you have already signed up to this. This is very much a collaborative approach. It's not just here in Newcastle, but also involves patients from London and from Oxford, as well as beyond if you attend these clinics. And this is extremely important. Obviously, government being government, we're always set targets for numbers. We're short of 81 people off 1,000 people that have signed up to the cohort from 3 centres. Newcastle has only 29 more people to sign up to this, and we fulfil our full quota. The reason this will always be important is not just to identify people with different forms of mitochondrial disease, but for us as clinicians, it also helps us recognise patterns of disease. So particularly for some of you out there who don't have a genetic cause for your mitochondrial disease, this is very much helping us. And also for people who have the last session, there's been quite a few questions come in asking about specific things about mitochondrial disease. So if I take one of my questions, somebody was asking about the incidence of renal disease. Well, we can go back to this cohort, look through the cohort and identify people who may potentially have kidney involvement and give you a bit of an idea within the UK how many people with mitochondrial disease have kidney involvement. We can look at children and how many have heart involvement. We can look at things like transplantation. So really, it's not just about getting names and numbers and about recruiting for future studies. It's also helping us see the pattern within mitochondrial disease and also help us recognise for patients different forms that they may have. Another form and another study that's ongoing at the minute is led by Professor Turnbull and by Tilly, who unfortunately can't be here today. Several of you have met Tilly already, and you'll have met me because I'm doing the muscle biopsies, and this is specifically looking at changes in your muscle over time. So this is again trying to help us and to help you understand the progression of disease. Particularly for people who have muscle involvement, we can look down the microscope and see mitochondrial changes. And what we want to see is, as time progresses, is what you tell us is changing. Can we correlate that with certain changes that might be in the muscle? Is that important? Well, yes, it is, because it would be nice for us to have a better idea of how the disease progresses, because that not only helps us to help you in the clinic, but is always very useful for future treatment. The next one, which a lot of you have been involved in, particularly here in this room, is looking at cognition and memory changes. A lot of this work has actually come from previous focus groups, but also from you coming to the clinic. And quite a few of you said that you have problems with your memory. And really this study has come from that, about changes in memory. Heather Moore, again, unfortunately not here today, is preliminarily running this study. And any of you that have been here, you realise it's a 2-hour session looking at different aspects of memory. We've been out to visit a few of you, and a few of you actually come in. This study is going really well. We've actually recruited our full quota of patients with mitochondrial disease, and that will help us look at different changes in memory. So things maybe that you might not automatically pick up, but we've picked up subtle things about we need to be careful when we give certain people information, because it's your ability to hear the information, take the information, and then react to the information you're given. So it's not just simple things like, oh, we can't find the keys, or I didn't lock the door, or didn't turn the cooker off. There's some more subtle things that you've been telling us about, and now we're actually able to pick up. The push today for recruitment here is for, we're actually looking for healthy controls. So we're looking for people who don't have mitochondrial disease that would be willing to help with this study, particularly anybody who's on the study. If you have a friend or a partner roughly around the same age, we'd be most grateful if they're interested in participating. Professor Turnbull already introduced Scott, who's standing there in the corner. Scott is the reference person today. If there's anybody interested or knows anybody, we've given details at the bottom of the screen, but you can go to Scott if you know anybody who would like to come on board. The next part is obviously the bit that I'm quite interested in, is exercise. And there's a website now for Move Lab that you can go to on the net. And it's just movelab.org. And that really introduces you to the whole team of the exercise department, of which we ourselves as the mitochondrial group are one of the leading forces behind the group. Any of you that have been into the lab will have met one of us or all of us here present on the board. So Mike Trinell, he's the clinical lead of the department. Julie at the back is very much involved in the lab part of the analysis. Don't need to introduce Professor Turnbull. Jane, our physiotherapist, who's very much running with Matt, the person below, the heart study. And any of you involved in that was looking at exercise and how it affects your heart. We already know that exercise is good for you, and we know that it's safe. But we're way back on the studies that Professor Chinnery was talking about. We're nowhere near close to randomization studies or placebo studies. We're at the stage where we need to be sure it's safe. So we know it's safe from a muscle perspective. But the next thing is it safe from a heart perspective? Because we'll be sending you out to exercise. That study's still ongoing. We've had a very good response, full recruitment to that study. But we're still trying to get the supposedly healthy controls through, so they're on their way to completing the study. We'd like to think by this time next year we should have preliminary results out in that for anybody that's taken part. We'll obviously feed back to people on a one-to-one basis coming through the study, but hopefully in a year we should have something that is publishable. The next study, which is by Catherine in the corner, is really leading on from some of our previous studies. So a lot of you here that carry the single deletion mutation would have been involved in a quite protracted study looking at exercise and the benefits of exercise. The last person come through that on Tuesday. So that study is really ready to be written up and properly analysed, and then us to feed back the results. But from that study, as well as a previous study, we realised that fatigue is a big problem, not just for people with mitochondrial disease, but also for some of the exercise that we were prescribing. So it's okay for us to give you something and say, oh, look, this works, but it's no good if you can't do it. So really leading from that part of the study, we've actually come to Catherine's study. And this is quite in vogue at the minute. It's to do with high-intensity exercise, so it's called the HIT study. And I don't know if any of you saw Horizon about a month or two ago. It was looking at high-intensity therapy. It's in vogue probably because the Olympics are on the way, and what you do is instead of doing a 30-minute cycle on a bike and being exhausted, you do a minute of high-speed exercise close to your maximum heart rate. You have a 2-minute break and then you start in again. And you might do 3 times that cycle and then you build up to 5 times that cycle. The rest, 2-minute rest in between, is just as important as a 1-minute cycle. Why is it important with Olympics coming up? Well, that's what all the high athletes do to cram before their final race. Well, if it works for them, causing less fatigue, well, why shouldn't we look at it as a potential therapy? And as I say, it really led from the other studies because of fatigue caused by us prescribing 30 minutes of cycling. So that study is really only starting. We're actively recruiting for that study. We had a very good response so far. We will at the start be looking for people to do high intensity, but also to do the conventional and compare the two together from cycling. So anybody interested, Catherine's at the back of the room. She's her physiotherapy uniform on. If anybody would like to participate or interested or more information, you can speak to myself or Catherine. And then really any other studies that are coming out of the exercise to be we'll keep you up to date of what's actually going on or with them. Any that's been through the lab, obviously you will have met George as well, who puts you through the exercise testing too. So really they're the studies that are actively going on at the minute. We're always looking for more studies and we're always continuing to more studies. But most of these studies actually are born out from what you tell us in clinic. So even though you might get a leaflet and go, where did that come from? It's actually, we do listen to you. And for any of you that are taking part in the fatigue focus group with myself and a few of my colleagues, the reason, the aim of that will be to get more feedback from you on how we can help you. We need to know what you think fatigue is. My idea of fatigue and your idea of fatigue, I now realise, are very different things. And that very much helps us in future to plan research that we do, and also that when we're applying for funding for research, that we have a better idea of what we're actually talking about and what's important to you. So the last of the studies, and this is really to come full circle where Professor Turnbull actually started off, is that Catherine is now leading a study looking at the incidence of complications in pregnancy with people with mitochondrial disease. And as we look back, we realise that in retrospect, women who were having babies could have had complications such as high blood pressure or diabetes, or there may have been problems with the baby. And it's only retrospect, looking back, we know this is the problem. This will very much fuel how we treat women in future that are coming through the generations when they're having babies. And this is quite important. And again, this has come about from a lot of information looking on the cohort that people have signed up to, and also what you tell us in clinic. And again, if anybody's interested, if you just have a word with Catherine, she'd be more than happy to take you on board. What I would say from this is, if you're over a certain age, don't be shocked that you get a phone call and go, I'm too old to have a baby. We'll be looking at every woman who's had a baby, because it's not just women who are potentially having a baby, it's actually more to do with the women that have had a baby, because we can learn from them and how we can actually help. If you're a mum with mitochondrial and your daughter has it, you can help us help your daughter to take better care of her when she's having a baby. So really, that's the end of my talk, and if there's any questions, please feel free to ask during the lunch session.